So today we are going to discuss in class about the reading. So the passing mark for the reading is 350 out of 500. This is the total number of score. So you have one complete hour for the reading. Now with reference to distribution of the time, we have 15 minutes time for part A. There are a total of 20 questions in part A. And then we have part B and C. In total, you have 45 minutes time for part B and C. And this is the number of questions for part B and C. So we have 42 questions in total. So the nature of part B, we have multiple choice type of question. These are emails, manuals, brochure, and so on. Then we have part C. There are two extract 1 and extract 2. 8 question in these extract. These are academia related or research oriented articles. But the point of discussion in this class will be your, we can say, like part A. The passing score that is considered to be 32, but the grading is relative, it's not absolute. So we have to expect some high number in there. Okay, so we can see there the part A, we have 4 texts, maybe from the same topic such as fractures. There are 4 different types of paragraph. Number of paragraphs or the length of paragraph may vary. We have 4 texts. The length of paragraph may vary. So in here you can see that after reading the text you can identify, okay, they are talking about the text or survey types. Here they are talking about the management, right? Here they are talking about the drug, let's say, administration, and here they are talking about the plaster black slab. Maybe I'll show you the text in a while. So we have to see that question number 1 to 7, they will write down the statement, and it's about the matching. Like you have to read the statement and nominate either it is from A, B, C, and D. From 8 to 14 is sentence completion, and from 15 to 20 we have fill in the blanks, right? So the skill that most of the candidates they are not focusing on the skill, they just try to practice and again. So the speed reading skills, how much strong you are in your reading. It's not only speed reading skills, but I would say it's a smart reading. Like read it thoroughly but quickly. You must have an ability to remember like what you have read and try to retain the information. And last but not least is the question understanding. It's important for you to understand. So speed reading skills is important. So we'll show you about like how can we go for the part. Now you can see that these are this is the topic, fractures, dislocation, and sprain. If you can see, this is the topic, fractures, dislocation, and sprain. So we can just go quickly and we can mark some important words. Let's say twisting, important, compound is important, maybe outstretched hand is important. Okay, this is important word maybe. Okay, in the management we have immediate management, we can apply the pressure, important word, immobilize, and pain reliever. In the clinical assessment, we'll just go quickly read it. Okay, anticoagulant, let's say warfarin, important. And these changes are important. Okay, physical examination, then we can see all places like say painful, swelling. Okay, skin color and range of motion, quickly read it. Out of shape, warm, throbbing or getting bigger, peripheral. Then in the management part we have splinting, alleviation, administered analgesia, compartment syndrome maybe, unrelieved by splinting, x-ray. So just try to mark these words and try to remember like as much as you can. So even we can differentiate the words from each other if you can, like anyhow. Afterward we can see that text C, it's about the drug therapy protocol, and only authorized healthcare workers such as medical officer and the nurse practitioner can administer the drugs. We have morphine, we have 2 routes, the dosage being mentioned. Just mention the keywords. Okay, lower end of dosage is 70 years and vomiting and drowsiness, respiratory depression, or give naloxone for that. Now this is a smart reading that for respiratory depression we can go for naloxone. This is black strap techniques. Same for arm and leg. We can recall the cotton socket, 2 to 3 centimeter padding. Jewelry maybe, neutral position, extra padding, plaster back slab. So when you read and mark those keywords, we can go to the paragraph. We can start in this strategy. We have read the paragraph quickly from 8 to 14. So first of all, read the question. Use the question with shorter phrase, right? What should we use to alleviate? So alleviate was where I remember, like say if it is in B, so we can go directly to B, and this is alleviate, and they are asking you about the lower limb. So a pillow is the answer for that. So we can write it down. Let's say just a pillow over here. Now next one is, what is the maximum dose of morphine per kilo? Again, the question is being asked maximum dose of morphine per kilo. So not only maximum, not only per kilo, but it's the maximum dose of morphine per kilo intramuscular route. So it's in the C, as we just have a quick review. In this intramuscular route for morphine, we can see that either the answer would be from this range and from this range. So most of the candidates selected or select this one. Why is that? Because this is maximum, but they can see they're asking you maximum per kg. So the answer should be 0.2. Okay. So we write down 0.2 as answer over here. Then we can see which part of limb may need extra padding. Extra padding, we remember it was in delta. So we can find the extra padding, and this is the answer. We can write it down over here. Moving on to the next one now. You can see there that what should be used to treat a patient. So respiratory depression. So remember naloxone was the answer, but we can see quickly this is the answer. We can write it down over here, and we can see that like the next answer to this question would be, what should be used to cover a freshly applied a plaster back slab? We can see plaster back slab. Now we have, if you remember, plaster back slab was over here. So we can write down creep bandage. And if you mark the keywords, what analgesia should be given to a patient who is allergic to morphine? It was in the management part, if you recall. You can see that here, not allergic to patient, fentanyl is the answer. Then we can move on to the next one. What condition a patient might have if pain persists after stenting elevation? So it was compartment syndrome in the B. And falling and outstretched hand is a typical cause of a dash. In this part, we must be grammatically correct. So we can see, if you recall, the outstretched part. If you can see, it's here. So dislocation is the answer for that. And upper limb fracture should be alleviated by means of a dash. So we remember that sling because we have done question 8. Make sure patient is not wearing any. We remember it's a jewelry. Check to see it's from this one. Swollen limbs are dash or increasing in size. Increasing in size, it was in basically Bravo. You can see there getting bigger. So throbbing is the answer for that. Okay, and next one, in plaster backslide there is a layer of dash closer to the skin. Now this is tricky question. Closest to the skin, we need to find in a plaster backslide there is a layer of skin closer to the skin. So from here, you can write it down, non-compression stockinette, right? And lastly, it's the patient age dash. Okay, patient age 70, basically higher dose of pain relief. So when we are done with this part, we can go to the 1 to 7. Procedure for delivering. Delivery was a key word. It's C. What to record when splinting a patient. Splinting was a keyword. Delta. When to record when assessing a patient. Assessment was keyword. Basically Bravo. The term used to describe different types of fracture. It was in A. The practitioner who administered analgesia, they have mentioned in C. What to look for when checking an injury. Okay, it was basically in B and A. So this approach you can go for part A. I hope this might be a quick lesson for that. But basically, even whatever strategy you'll find, because today we have to discuss the strategy that you have to skim and scan the paragraph, then go to 8 onward. So whatever strategy you will be following for this reading part, try to work on, first of all, speed is important. Secondly is the short-term memory. That has to be developed in this part. So I hope this will be helpful for you, this today's lesson.